Good afternoon. Thank you, Senator Gerentano and Representative Ritter and ranking members, Senator Markley and Representative Srinivasan. I'm here to talk about or support Senate Bill 353. However, I think, and I'm just going to read some of my testimony and then just talk a little bit why I think we need to be doing much more. It's no surprise to anyone here there is an opiate crisis in Connecticut and in our nation. Literally every corner of our state has experienced a spike in opiate and heroin addiction and overdose deaths. We, along with members of the legislature, have hosted forums with our communities, law enforcement, addiction professionals, prevention councils, support groups, and the news is quite frightening. I've learned opiate use produces a powerful addiction that turns good people into shells of their former selves. Opiate addiction is destroying families' lives across our country. It is a serious epidemic and will require everyone working together. Research has shown a direct link to the introduction of the pharmaceutical drugs, OxyContin, and related drugs to the explosion of the opiate and heroin addiction across our country. This drug was originally developed to help seriously ill individuals and then for those with chronic pain, to now being prescribed for dental procedures and for whatever minor pain or procedure someone has. The data is crystal clear, linking opiate prescription drugs to an epidemic that is destroying our state and country. We've put in some proposals, a bunch of us together, just listing ensuring appropriate and proper prescribing of opiate drugs, requiring a writer or special certificate to prescribe opiate drugs. I spoke to some doctors who said that right now opiates are considered a Schedule II drug, and there could be listed like a Schedule IIA to be actually able to prescribe opiates. Require addiction training for medical professionals who prescribe opiates, set up secure drop-off boxes for unused drugs in local pharmacies, as you've spoken about, and reducing the amount of the prescription drug being prescribed, limiting first-time refills to 72 hours. And also, I know we're looking at Narcan being more widely available. We've submitted testimony to the Judiciary Committee, a bill about death by dealer, which other people have spoken about. And we've also would like to see, hopefully, you could work with the Department of Mental Health and Addiction Services, develop and release a large-scale prevention and support campaign with public service announcements on TV, internet, radio, and print, sharing the serious dangers of opiate addiction, similar to the campaign we have done in the past with cigarette smoking. Families of addicts need support. These addicts need support. And, we've been doing a lot of forums on this, and, we're having young people and older people dying in our state every single day. And I know that you're looking at adding on to a council, but I feel like this is a 911 emergency, that we have to do everything. I mean, we just had a woman who came up a little while ago talking about her son dying. This is happening every day. People's children are dying because this drug is so dangerous. It's so dangerous. And, somebody gets prescribed an opiate for a wisdom tooth removal and becomes a heroin addict. I mean, this is an outrageous situation. And I feel so helpless, and I'm hoping that we can do some things to make a difference, to reduce the amount of prescription drugs that are being prescribed throughout our state, and some mental health. I've met with the commissioner, and I hope that as your committee would work more closely with the commissioner, because I believe we can be doing a lot more to highlight the danger of this drug. I feel like this generation, or the last 10 or 15 years, people don't realize how dangerous opiates are. And once they've started using them, it's too late for them to crawl back out.
And I think we should be doing it.
But frankly, I think we need to be doing a lot more than just this. I honestly, I can't stress enough how I feel like this is a 911 emergency. People are dying. We don't have enough beds. People are having kids, addicted to drugs at their house on opiates. They go to the hospital. They throw them out 2 days later. Families have nowhere to turn, and then they end up dying. I feel like we really need to make this a serious priority. And if you can hear the passion in my voice, I've been through this on a personal level, and this is heartbreaking for families. It's heartbreaking that they have nowhere to turn. And I feel like we can do better. Absolutely. And we've done, many of you have done forums. I've done a forum in my community and will continue to do them. Law enforcement, doctors, drug and alcohol professionals. And they'll tell you that opiates and heroin addiction is a stigma. So family members who have members of their family who use them are afraid to speak out about it or to talk to anyone about it because they are embarrassed about it. That further complicates the problem because they're not saying my child or my spouse or my whomever is addicted to heroin. The access to opiates. Families will tell you over and over again when you spend time with them, access to opiates. So for example, wisdom tooth, prescription of 30 or even 20 Oxycontin for your wisdom teeth. So someone takes 1 or 2, the rest are in the medicine cabinet. Some kid brings them to a party and passes them out, and now all the kids are trying them. And next thing you know, you got a bunch of kids addicted to this pill. That kind of stuff is happening. And so reducing the amount of drugs, this drug is very serious. This isn't like, the drugs that we were given when we had a dental procedure growing up, most of us. This is a real serious drug. You could take one and be addicted to it, just one.